Thank you, and we thank the Honorable Prime Minister for his comments. In the last 24 hours, the Fiji CDC again undertook 23 tests, of which 2 were positive, as you have heard. Case 13 is the mother of case 3, who was admitted at the Nandi hospital and have been in isolation ever since the confirmation of case 3. So she is a second generation contact of our case 1. She is in fact the sister, and have been in direct contact with the baby all along as they were together. Case 14 is the wife of case 9, so she is a direct contact of case 9. She is also elderly. She is more than 60 years old and has chronic diseases, so she is in the hospital, currently in Lambasa Hospital, alongside her husband, and also under the care of the Ministry of Health staff. So at the moment, we remain with 4 clusters of COVID-19 patients, and the 2 newly diagnosed cases constitute members of cluster 1 and cluster 3. The fever clinics, as stated by the Honorable Prime Minister, continues, and so does the contact tracing work, as well as the quarantine enforcement work by our teams. We are thankful to the people of Lautoka for supporting our contact tracing team, and the Lautoka team will continue again today, and we are again appealing to the population, the people of Lautoka, the greater Lautoka area, to support our team as they come to your homes and to where you are to talk to you and interview you. Our 12 known cases prior to these new cases remain stable and are in our isolation facilities in Lautoka, Nandi, Nabua, and Lambasa. And we have also completed contact tracing for all their immediate contacts, and who are now under close surveillance by our team. To conclude, we reiterate our messages. Our messages are not changing, and we are saying the same things every day, and we are saying it again today. As stated by the Honorable Prime Minister, please stay at home and save lives. Minimize the opportunity for the virus to travel from a person to another, from homes to another, and from one community to another. The virus doesn't fly, the virus doesn't jump, it needs a human to transmit it. Don't be that person. Secondly, we are asking everyone to be honest and tell the truth. Our health workers, our contact tracing team, our quarantine team are coming to our communities, getting critical information that are important for the work that we are doing and for this fight. And we ask that you don't withhold details that you may think are trivial, but may turn out to be the critical information that helps and supports our work. And lastly, we encourage everyone continue to wash your hands regularly and at all opportunities, 20 seconds with soap and water, or use an alcohol-based hand hygiene. Don't touch your face. Practice social distancing. Coughing and sneezing into a tissue or elbow if you don't have a tissue. We ask everyone to abide by these measures, as these measures will help us in our fight against COVID-19. Thank you very much.